This video has been commissioned by the Ministry of Health and Social Services for educational and informational purposes only. The individuals and images depicted are for demonstrative purposes only and may not be construed as indicative or representative of real patients affected by any illnesses described, depicted, or otherwise alluded to in this video. The video has made use of actors for demonstrative purposes. The statements made in this video may not be construed as medical advice. The information is not intended to replace medical advice offered by physicians. How much do we know about the institution responsible for the overall health and welfare of every single member of our society?
I feel very proud to be in theater because I have been trained as a theater nurse.
We are here, we are from a school in Norway, so we're just here to observe and learn from the Namibian culture.
Restoring the heart of our people is most that motivated me to accept to be placed in a cardiac theater.
So working here really motivates a person, seeing different patients and encouraging others to come also for operations.
The mandate of the Ministry of Health and Social Services, MOHSS, is derived from Article 95 of the Namibian Constitution, which emphasizes the adoption of policies and the enactment of legislations to ensure the health and strength of Namibians. Drawing from the supreme law of the country, the ministry's mandate is to provide and protect the health of the Namibian people and provide quality social services to all, especially the weak and vulnerable members of society. Among the functions of the Ministry of Health and Social Services are to create an enabling environment to provide quality healthcare and social services for the attainment of the national policies, legislations, and development plans of our country, including Vision 2030 and the Harambee Prosperity Plan. The ministry continuously develops the capacity required for health planning and social services and maintains a database of the information necessary for making policy decisions. Our work in fulfilling our constitutional duty is underpinned by the commitment of our leadership, management, and staff to our grand and noble vision to be a leading public health provider that ensures a long and healthy life for all Namibians. To achieve this, we endeavor to implement our mission to continuously improve the health status of Namibians by providing integrated quality and accessible health services.
I would like to indicate is that the people well-being, it's the core of our mandate, and we have drafted a strategy to address the people well-being. Here we would like to address the communicable diseases like malaria, HIV and AIDS and TB. So those are the three main killer diseases in the country that we are already spending time and resources to be able to eliminate those diseases in Namibia.
So quality healthcare provision, it's a very, very essential component of my mission in this ministry. And we can only do that if we have skilled personnel, if we have adequate personnel, if we have the resources and equipment that we need, and if we have a drive to make an impact. So it's why it's very important that quality healthcare provision should be the core of our healthcare provision, not just healthcare provision. It should have a component of quality.
I think we are on the right track, and one can subscribe or describe this as a kind of success, but much obviously needs to be done indeed.
In 2009, the Ministry of Health and Social Services established a special medical fund to provide financial assistance for the special medical treatment of state patients. The fund is used to treat state patients with special medical conditions that cannot be treated at any state clinic, health center, or hospital, usually due to the unavailability of specialists. The aim is to prolong the life expectancy of the patients and manage their conditions further by using private health facilities both locally and internationally. Since its establishment in 2009, the fund has treated over 800 patients. The initiative was further strengthened by the National Health Act 2015, Section 51, which officially enacted the Special Medical Aid Fund. Some of the special medical conditions catered for under the Special Medical Aid Fund include cardiac angiogram and the insertion of stents currently only done outside of Namibia, cardiothoracic surgery including cardiac bypass, radical prostatectomy, major spinal surgery including the insertion of internal prosthesis, major brain surgery including brain aneurysm repair, major abdominal surgery, abdominal aorta aneurysm repair, organ transplant including stem cell, liver and kidney transplants, radiotherapy for cancer patients, kidney dialysis, special surgery for resections, and any other treatment that requires treatment in an intensive or high care unit in a hospital due to post-surgery complications. In order to access the special fund, a patient should be treated by a state doctor at a public health facility first. The doctor will then apply to the special fund should the treatment required by a patient not be available at a public health facility. Upon approval by the Permanent Secretary, who is the fund administrator, the ministry will pay the total cost of treatment, including transport for treatment at a local private hospital or private state hospital in South Africa. In 2013, the Ministry of Health and Social Services embarked upon Project 2013 to train health professionals to address the challenge of staff shortages in our country. Project 2013 emanated from a cabinet decision forming part of the implementation of a recommendation from the Presidential Commission of Inquiry regarding the acceleration of training of scarce health professionals. The ministry was requested to train 750 students in health-related fields locally within the SADC region and globally. In this regard, the ministry has created and funded a number of undergraduate scholarship programs over the last few years, including the training of medical officers who are currently sent overseas, a diploma program for registered nurses currently run by the ministry locally, and other disciplines. The ministry also funds postgraduate training for specialization by doctors and nurses in various disciplines.
We started off basic stuff basically, and then as the years advanced, we started doing more of practicals and all that, and then I got to love medicine.
It has been a great experience, especially the practical parts where you have to be in the hospital. Like, I like the practical part, I love being in the hospital. Like, yeah, it has really been great.
The project commenced in 2013, and to date, a significant number of students are studying medicine and other health-related fields in Russia, Zambia, South Africa, Cuba, and India. The ministry also plans to send students to Tanzania and Ghana. A budgetary allocation has been approved by the cabinet to fund the project for the next 3 years, with the initial total amount for the project set at 283 million Namibian dollars. Community Health Workers Program. The Ministry of Health and Social Services adapted the Community Health Program, originally called the Health Extension Program or HEP, from Ethiopia before introducing it in Namibia in 2010. Community health workers, previously called health extension workers, are community members holding at least a grade 12 level of education who have completed a 6-month intensive training course in health-related issues, after which they are able to provide basic healthcare services and health promotion within their own communities. By providing the first level of care to patients, the community health workers assist stabilize patients with minor or major ailments prior to referring them to the local clinics or healthcare centers for further services as required. The program is especially beneficial in covering men, women, and children impacted by easily treatable and preventable diseases in remote and hard-to-reach areas of the country. The intervention reduces the possibility of patients developing complications from diseases and incidents of death. The community health workers are armed with a medical kit containing various tools and treatments for first aid and certain ailments such as diarrhea. The pilot health extension program was launched in the Kunene region with 35 community health workers. Later, the program was expanded with the training of community health workers in all 14 regions. Specialized healthcare services at Windhoek Central Hospital. The Windhoek Central Hospital is the national referral hospital in Namibia, with a mission to be the leading innovator in providing specialized healthcare services to the nation. The hospital has a specialized mandate in comparison to other health facilities in Namibia, in that only patients in need of emergency specialist medical care, meaning life-threatening within 2 hours, who cannot be rendered at the regional or district hospital, the clinic or the medical practitioner, can be seen at the facility. This also means that no walk-in patients are seen, as all patients need to be referred via a medical practitioner, clinic, or hospital within the referral system. Specialized services offered at the Windhoek Central Hospital include cardiac, oncology, dialysis, mental health, and the maternity units, amongst others. The cardiac unit. The cardiac unit was inaugurated by His Excellency President Hifikepunye Pohamba and the President Thabo Mbeki on the 8th of October 2010. The unit is divided into 8 distinct units, each with its own management and service delivery protocols and identity, striving to provide comprehensive cardiac care in a stress-free and supportive environment. Services offered include adult cardiac surgery, pediatric cardiac surgery for patients weighing more than 10 kilograms, and general thoracic surgery. Over the years, the unit has successfully operated on patients requiring open heart surgery and surgery for chest, lung, and esophageal disease.
We are a busy department, so we do operations. We've got 8 operating rooms, starting from ophthalmology to urology. So every day we've got a theater list for different operating rooms. So basically we are very busy and it's getting very hectic.
I would love all the young nurses to come and join this cardiac theater. As for now, I can say we are phasing out. So we need young nurses. We want to train them so that they can be able to assist the surgeons with these operations.
The Radiation Oncology Department. The Radiation Oncology Department was established by the government with the assistance of the International Atomic Energy Agency in 1997. Radiation oncology is based at Windhoek Central Hospital's Dr. A.B. May Cancer Care Center. The department is open every day to cater for daily patients' radiation treatment, opening at 8 a.m. and closing at 5 p.m. for normal hours. The activity of the Radiation and Oncology Department include radiation therapy for patients with benign, non-cancerous, or malignant cancerous tumors. The medical staff currently make use of the available equipment and machines, including an X-ray machine for diagnostic imaging, a Cobalt-60 teletherapy machine for external beam treatment, a high-dose rate brachytherapy machine for internal beam treatment, a computed tomographic machine for patient plans, and a treatment planning system that makes planning more efficient and facilitates a proper dose to localized tumors. Maternity units. The maternity units at Windhoek Central Hospital were newly renovated and officially inaugurated in 2013. Since then, the unit's services and client numbers have continuously grown. The maternity ward at Windhoek Central Hospital is the only national referral maternity ward in the country and treats cases from all regions with varying degrees of complications during the pregnancy, antepartum, and postpartum periods. The maternity units at Windhoek Central Hospital currently cater to private and state patients alike. The maternity wards also host a number of students from various training institutions. The students are prepared in clinical practice for services as future midwives or registered nurses. The department consists of 4 units, namely the antenatal clinic, the antenatal ward, the postnatal ward, and the prem unit. Mental health care.
To me, mental health is a passion. It's not really a job, because I really like working with this mentally ill patients, and it's satisfying seeing a patient coming in sick and leaving the department and is healthy and can go back to the community.
The Mental Health Care Center is a subdivision of Windhoek Central Hospital. It is located between the maternity ward and the medical school. The center has been in existence since 1903 and has a bed capacity of 200 beds. Mental health services are provided under the Mental Health Act, Act number 18 of 1973. The center's model of choice is the biopsychosocial model of health, which is employed in a multidisciplinary and interdisciplinary setting. The model looks at three components that affect mental health, namely biological, social, and psychological. The services rendered at the Mental Health Care Center include medical services from doctors responsible for conducting mental status examination, coming up with a diagnosis and prescribing medication. Government is fully cognizant of the reality of mental health disorders in Namibia, and thus all services at the Mental Health Care Center are free. Patients, upon arrival, are treated and allowed to leave upon completion of treatment, with medication in some cases. However, private patients are charged. Dialysis. The Windhoek Central Hospital currently does not have a fully functioning dialysis unit, but rather a section or function which operates within the ICU unit. This section is responsible for acute patients within the ICU unit referred by the doctors from the medical wards. Dialysis or renal replacement therapy assists in the exchange or removal of fluids within the patient's system, thereby correcting the patient's hemodynamic status. HIV treatment program. Immediately after Namibia's independence in 1990, the Ministry of Health and Social Services developed a National AIDS Coordinating Program, NACP, under primary health care to respond to the emerging HIV epidemic. During the pre-ARTs or antiretroviral treatment era, cases increased along with the demand for HIV care hospitalization. The first pilots of ARTs were introduced during 2004 and 2005, starting with the pilot programs for the prevention of mother-to-child transmission. Prior to this, only HIV testing, continuous counseling, treatment of opportunistic infections, and palliative or end-of-life care services were available. Funding from the US President's Emergency Plan for AIDS Relief, PEPFAR, played an instrumental role in making HIV treatment available to large parts of the Namibian population starting in 2004, and significant reductions in hospitalization and death from opportunistic infections related to HIV and AIDS were already noticeable at health facilities starting in 2006. The program commenced with approximately 40,000 patients on ARV treatment. This number has grown to over 200,000 Namibians currently on ARV treatment today. Fixed dose combination, single tablet. When ARVs were first introduced, patients received multiple tablets to take daily. Recently, a fixed dose combination has been formulated into a single tablet with different types of medication required to suppress the HIV virus. The FDC has been rolled out in Namibia to most patients on ARV treatment since 2014 and still ongoing. Prevention of mother-to-child treatment program.
One of the very successful programs we carried out is the prevention of transmission of HIV from a mother to the child. We have narrowed it down to less than 5%, and we are among the only 3 countries in Southern Africa that has come to the same level, or maybe 4. We're probably the 4th country out of the 54. So that's a successful program, and we're looking at actually eliminating it in total. That maybe within the next 3 to 5 years, there will be no child born in Namibia born to an HIV positive mother and that child is positive. That will be hopefully a thing of the past. So that's a very successful program.
The Prevention of Mother-to-Child Treatment Program was introduced during 2004 and 2005. Initially, expectant HIV-positive mothers were given prophylactics about 4 weeks before the scheduled childbirth. However, more recently, expectant mothers are placed on treatment immediately following diagnosis from 14 weeks onward. This is referred to as the PMTCT option, B+. The ARV treatment is then continued for the mother following birth over her lifetime.
It's been 25 years, peace, stability. prosperity, oh prosperity. One Namibia, one nation.
The Ministry of Health and Social Services is a multi-faced institution responsible for a critical constitutional pillar of our society. We continue in our tireless endeavor to create an enabling environment to provide quality healthcare and social services for the attainment of our national policies and development plans, including Vision 2030 and the Harambee Prosperity Plan. Our leadership, management and staff is fully committed to executing our constitutional mandate through rigorously focusing on the institution's vision, mission and core value. This dedication and focus will ensure that the ministry will continue to provide integrated, affordable, accessible, quality healthcare and social services responsive to the needs of the population for this generation and the generations to come.